I wanted to talk to you about a lawsuit that was filed in the state of California this week. They actually had a press conference, and the guy right here, that's Rob Bonta. That's the Attorney General of California. And this lady at the podium is Anna Nusslock. And I'm going to tell you Anna's story because I'm not going to read to you from the lawsuit because it's long and it gets complicated, but it is disturbing. But you should know what she went through and why she is suing uh, filing a lawsuit in the state of California and why she has the attorney general's help. So, again, it is disturbing, but here you go. According to this lawsuit, back in February of this year, Anna was rushed to a hospital because she was pregnant. She was only 15 weeks pregnant, and she was at home and her water broke, which is way too early for water to break. She was pregnant with twins. The water broke. This wasn't good. She had to get to a hospital. And so she was rushed to like the nearest hospital. As far as the lawsuit said, she was in pain, she was bleeding, and all the tests at the hospital basically confirmed her worst fears, which is that the twins she was carrying were not going to survive. I believe one of the fetuses was already gone. The other one had a heartbeat, but it was as good as gone. It wasn't going to make it no matter what they did. So all of that is tragic. It happens. Miscarriages happen. Something like this does happen. And it's sad. And that's more than enough tragedy for any one family to have to deal with. But the hospital decided to make everything worse. And this is where it gets even more disturbing because the focus at that point needed to be on helping Anna because, according to the suit, she was at increased risk of serious complications with every minute that passed. Because now you have these dying fetuses inside of you, and it actually poses a health risk to you if you don't get them out of your system. So she needed to remove those fetuses from her body to avoid immediate health problems, like the possibility of infection was really high. And also, you had to remove them from your system in order to protect the ability to have kids later on. I believe she's in her 40s. This was already a high risk pregnancy. But if she wanted any chance of having kids in the future, they needed to take action really quickly to make sure she's safe. So, the normal way to handle this situation would have been a medical abortion. Let's get these fetuses out of your system now. They're not going to make it. We just need to make sure you're safe. Unfortunately, the hospital she was at was Providence St. Joseph Hospital in the city of Eureka, California, and that's a Catholic hospital. And they don't do abortions for any reason. And this is a part of the lawsuit I wanted to share with you because this was troubling. They basically told her, you have a couple of options. I'll show this to you in a second. Um, the doctor there at the Catholic hospital said there is still a detectable heartbeat in one of the fetuses, which is why they couldn't help her, because then it would have been an abortion they can't deal with. The other option, if not doing an abortion, is we can wait for your health to get even worse, because if you're really close to dying, then that overrides the abortion rule and then we can help you, but you're not quite dead yet, is basically what they told her. So at this point, like even the doctors at the hospital who know better than the Catholic bishops who write the rules about how the hospital operates, the doctors were like, wait, there is another option because we know you need help. You can be airlifted to a hospital several hours away that specializes in high risk pregnancy. But Anna heard that option and she's like, they could take me to a real hospital, like a secular hospital hours away. But if I get airlifted, and because this is America, if I get airlifted, it's going to like lead to a cost of tens of thousands of dollars, maybe like $40,000. And she knew her insurance would not cover that cost. Another downside to the helicopter taking her to the other hospital is that her husband would not be able to be in the helicopter with her for like space reasons. So she would have to do it alone. And she didn't want to do that for obvious reasons. So that took out the getting airlifted to another place. She asked the Catholic hospital, "Can I drive there? Can I drive to this other hospital?" And the doctor said, "If you try to drive the 5 hours, you will hemorrhage and die before you get to a place that can help you." So driving herself was not an option. So then a doctor came up with a different solution. They said, "You know what? There's another hospital that's about 20 minutes away. They don't specialize in high risk pregnancies, but basically, like, it's a secular hospital. You can probably get what you need, maybe, and it's only 20 minutes away." So she's like, "All right, well, should I take an ambulance there?" And she said, "I'm not going to take an ambulance because, again, America, my insurance is not going to pay for an ambulance to take me 20 minutes." So she said, "I'll drive myself to the hospital." And guess what the hospital did then? Check this line out in the lawsuit. Number 3, instead of providing the medical care she needed, Providence Hospital offered her a bucket and towels. And I know this is early in the lawsuit, but this is what happens in this part of the story. As Anna was driving the 20 minutes to the nearby hospital, they literally gave her a bucket and towels just in case anything happened on the way there. That's messed up. And by the way, she never should have been discharged because of the situation in which she was in. In a way, she was lucky because that new hospital did have the equipment to give her the care she needed, but it wasn't the best option, like that other hospital several hours away. And one other thing to note is that when she went to that hospital 20 minutes away, the doctor there said she was actively hemorrhaging when she arrived. Like, they are lucky they got to her when they did. Another thing about that hospital she got to, they did help her. They did save her life. But that same hospital, as of October this month, they are shutting down their labor and delivery services because that happens to a lot of hospitals that are smaller. What would have happened if Anna was in this situation next month as opposed to earlier this year? Then that hospital would no longer be an option for her. She would probably be dead by now. So, in the Attorney General, in his press release, that's exactly what the Attorney General said. Check this out. The next person in Anna's situation will face an agonizing choice of risking a multi hour drive to another hospital or waiting until they are close enough to death for Providence to intervene. That's from the Attorney General of California. So, in a way, she was lucky because she did get the help she needed. But the reason the attorney general is getting involved is because California has something called the Emergency Services Law. And what that says, it's basically designed to protect people in exactly this situation. It prohibits hospitals from dumping patients off to a different hospital because they don't want to take care of you. And it also requires any hospital with an emergency department, like this Catholic hospital, as long as your emergency room is open to the public, like this one was, they have to provide emergency care for you. They cannot legally send a patient away to avoid performing an abortion, even if they would have the right to do that in non emergency situations. So California's law said she came to your emergency room, she needed an abortion. That was the right medical care she needed at the time. I don't care what hospital you are, you have an obligation to provide that service. I don't care if you're Catholic, if you're a hospital with an emergency room open to the public, you got to provide emergency care to all those people. And the Catholic hospital refused to do that. And that's why the attorney general is now getting involved. So, in addition to the lawsuit that Anna and the Attorney General, State of California, is now filing against Providence St. Joseph Hospital, the Attorney General is also filing a separate preliminary injunction, basically saying to a court, while lawsuits take time, and while you are dealing with this case, we want you to issue an order saying, hey, Providence, if anything like this happens right now, today, you're going to take care of it. We want you to tell the hospital they got to do this in the immediate future. And separately, we'll deal with Anna's case as a separate thing. Now, what did Providence say about all of this? They're basically trying to deny anything bad happened. This is from the Sacramento Bee. A spokesperson for Providence Health, the hospital's parent company, headquartered in Washington state, said in a statement that Monday morning was the first Providence had heard of the California Attorney General's lawsuit, and we are currently reviewing the filings to understand what is being alleged. Really? I read it in 4 minutes and I figured out what was being alleged. It's not that complicated. You didn't provide care. You are a healthcare facility. Bad. It's not that complicated. And then they declined to comment further. Yeah. They said they're heartbroken by her experience. No, they're not. And then check this out. Providence is deeply committed to the health and wellness of women and pregnant patients and provides emergency services to all who walk through our doors in accordance with state and federal law. And it is friggin' hilarious for any Catholic institution to say, you know what we care about? The health and wellness of women, because that has never happened in the history of the Catholic anything. Like the reason we're having this discussion at all is because they literally did not provide the care that Anna needed. So they'll respond in court eventually. But again, like I said, it's not complicated. A patient needed emergency care. That care involved an abortion. Abortion is health care. The Catholic hospital refused to provide health care because it prioritizes almost dead fetuses over living, breathing women. They wanted Anna to suffer even more before they would even consider helping her out. That's how pro-life they are. So pro-life, they were like, maybe you should try dying a little more so that we don't have to do an abortion. Like, honestly, this isn't even about abortion. This is about whether Catholic hospitals should be required to help patients, period. You know, there's a saying among liberals that abortion is healthcare. And this is a perfect example of that. This Anna did not want an abortion. She wanted to have those babies. She could not. Like, she needed an abortion to save her own life. But Catholic Church bishops, like so many anti-abortion activists, have no idea how to distinguish between those two things. And again, this is scary because this is in California. This is obviously and famously a blue state. If a patient can be denied abortion care in California, imagine how much worse this situation would be in like Alabama or Mississippi. And this is not just because of the Dobbs decision. This is what happens when the Catholic Church, with its wealth and power, can start gobbling up so many hospitals across the country, which is the thing that is actually happening. Anytime you elevate faith-based rules over medical expertise, patients are going to suffer. If the Catholic Church doesn't want to help patients in tragic situations, then they should get out of the healthcare business immediately. Okay, I'm going to stop there with that story. I hate that story. Happy to take questions, though. Oh, thank you for that super sticker. I appreciate that. Providence is such an ironic name in this case. All the Catholic hospitals, they always have those weird names like Dignity. It's like, there's no dignity here when you're doing stuff like this. Like, just call it Catholic Hospital. We all know what it means. Stop trying to hide behind an ostensibly secular name. What else we got? If this happened in Alabama or Mississippi, she would have no support for her claim. Yeah, they would absolutely not be fighting this battle against the Catholic hospital in any red state. Catholic hospitals just shouldn't exist, full stop. Or if they exist, make sure there are enough secular hospitals nearby. If people want to go to a Catholic hospital, I don't know why, but if they want to, fine. But that's a problem when Catholic hospitals are taking over regional hospitals, leaving patients with no other option. And I'm going to have another story on this soon. And I think this comment will apply even more then. Too many horror stories. How many horror stories do we not hear about? No kidding, right? With all the abortion stories, the ones we've heard about a woman, I forgot which state, Alabama maybe, or Arkansas, who died because she didn't get the care she needed. How many of those stories do you not hear about? And then, some people have the courage, like Anna in this story, to speak out and actually be the public face of this lawsuit. Incredible courage in the face of the personal tragedy she suffered.